Hello, everyone, and happy Friday. Thank you, everyone, for joining us today for the Center of Victim Research panel on building research and practitioner partnerships. My name is Marina Duane, and I'm a research associate working with CVR to help build a community of collaboration between victim researchers like you and service providers. As you know, in 2018, CVR funded 9 research and practitioner fellowship projects, and today we will be hearing from 3 of these fellows, including Karen Geert, Nkiru Nabulezi, and Carolyn Hartley. In this short 30 minutes that we have together, I'm going to ask each panelist to briefly introduce themselves, and then we will go straight into questions, and I will ask one question of each fellow. So let's start with Karen. Karen, if you could go ahead, unmute yourself, and introduce you and the fellowship that you've done. Karen?
In Champaign, Illinois. And the focus of our project has been to work with the researchers from the Land Grant Institution, University of Illinois, to look at expanding our community, to implement the CAP program, Community Advocacy Program at Courage Connection, and to look at expanding our community advocacy capacity as we're an agency in transition, and to evaluate those and increase those capacity efforts and evaluate those efforts, and to create instruments that can help monitor and document the CAP implementation process.
Thank you so much, Karen, for the introduction. And for those who were not able to hear earlier on, Karen is a program director at the Courage Connection. And now we are going to go to Nkiru. Nkiru, if you could unmute yourself and introduce yourself and the fellowship.
Hi, good morning. Can you hear me?
Yes, we can hear you just fine. Thank you, Nkiru.
Perfect. So I'm an assistant professor of community psychology at the University of Maryland, Baltimore County. My community partner is Ozan Dongo, who was the program's director at the DC Coalition Against Domestic Violence. And at the time that we applied for this fellowship, our partnership was emerging. We had just co-founded the Domestic Violence Action Research Collective in DC. And the aim of that group is to generate and implement high-impact survivor and community-centered research and evaluation projects that really build survivors' power, increase survivor responsive care within systems, and enhance individual and community safety. And so the R2P fellowship that the project that we're focusing on is bringing together practitioners, survivors, lawyers, policy analysts, and researchers like myself. And I'm going to talk about that relationship today, building that type of partnership together. And we actually conceptualized a study through this group, and it's called the DV Housing Screening Study. And the goal of that study is to understand how survivors who are homeless or housing insecure in the District of Columbia are being screened for domestic violence when they seek out crisis housing services from the housing system. So I'm excited to be here. Thank you for having me.
Wonderful. Thank you so much, Nkiru, for that introduction. And last but not least, we are going to have Carolyn Hartley introduce herself. Carolyn?
Thank you. This is Carolyn Hartley, and I'm an associate professor at the University of Iowa School of Social Work. My practitioner partner on this project is actually a unit within the university. It's our Office of the Sexual Misconduct Response Coordinator, which is the central office on our campus that receives all of the reports of sexual misconduct that come through, both from students and faculty and staff. And the OSMRC, that's their acronym, actually sort of kind of operates like a directing traffic to assure that all of the different parties that are involved in investigating or adjudicating a report of sexual misconduct are kind of following through with different pieces. They also work individually with students to provide accommodations or supports that students might need as a result of the trauma that they experienced. They're also do a lot of work with helping students understand their reporting options. So our initial focus of this project was to look specifically at the adjudication process, like when things got to an investigation hearing of sexual misconduct, with the goal of developing a conceptual framework and a research design to look at the experiences of both the student complainants and the student respondents in this process. And through the work that we've done so far, we've sort of expanded our focus to the overall reporting process, because what we found is that a relatively small number of cases actually end up in a formal hearing, but a fair number of students are having contact with the OSMRC office to receive supports of various kinds. So we're kind of looking at a somewhat more expanded vision of understanding this overall reporting process of sexual misconduct.
Perfect. Thank you so much, Carolyn. So now that we have introductions out of the way, we are going to dive into questions. And I'm going to start with Karen. Karen, as you told us in the introduction, you've been working with the University of Illinois to adopt an evidence-based model for domestic violence survivor advocates. Could you tell us how you went about forming your researcher-practitioner partnership, and maybe how did you grow this relationship over time throughout the fellowship period? Karen?
Well, I've just been in my role as program director for less than a year and had previously worked throughout my career in a land-grant institution in a number of states for a major community outreach program. So I was very familiar with, aligning the research interests of faculty members with the programmatic needs of, the agency or the institution in which I was working. So when I took this role, there was already a relationship established between the researcher, the School of Social Work researcher and the executive director of our agency. And so as I was coming on board, even before I actually started, I met with Nicole Allen, who is the researcher, to talk about, how to develop this proposal, and of course she put the proposal together. And as we have moved forward then in continuing to build that relationship between the School of Social Work and our agency, we have worked Nicole and I have worked very closely together, along with pulling in the appropriate staff members, whether it's staff client coordinators or program managers, to address. We had weekly meetings, and we pulled in the appropriate people because we realized at some point that we didn't have all the stakeholders at the table. So we kind of took a step backward and brought in, the other stakeholders. We began with developing a logic model around what we were trying to accomplish, and then had weekly meetings and just, began establishing that rapport and that relationship, not only between myself as the program director and the researchers, but also the researcher and our staff, because as they are going to be the boots on the ground in implementing the CAP model, it's important that they have a strong relationship with the researcher as well. So those are I guess, a couple of the things that we've done. But it also goes to, in terms of forming that relationship and building on that relationship, I think it's the understanding of, the researcher and myself as, the practitioner, to really realize what each person brings to the table. And, with the land-grant institution and the researcher, they can bring that expertise to the table and those skills to the table that we in the agency don't have, but then we in the agency can work with them to help to implement and operationalize and evaluate that. So it's recognizing, in terms of building the relationship and growing the relationship, it's really recognizing the strengths of both partners and what each partner can bring to the table. And I would best describe it as aligning the research interests of the faculty member with the programmatic needs of the agency, and that's always a win-win situation. and one in which, you know, we will continue to build upon that through as we work through the process of training the staff on the CAP model, and then beginning to evaluate that model and see how it's worked, and then we're going to pilot it, and then to make adjustments where we need to make. So I think it's just, you know, each party or agency brings to the table a skill and a strength, and then we recognize that, and we just continue to build upon that and see where we can go from there and seize new opportunities when they arise.
Thank you, Karen, and that's fantastic. I do have a follow-up question for you. I think it's so interesting that you, as a program director, obviously recognize the need for your staff, people with, you know, boots on the ground, to be connected to researcher. And I'm curious to hear, as someone in a leadership position, how did you go about helping your staff recognize the value of them connecting with research? Sort of, what was your sales pitch to them to connect with researchers and to dedicate their valuable time to this process?
That's an interesting question. I don't know that there really was a sales pitch to involve them. It was bringing them to the table and making sure that we had all of the right stakeholders at the table and all the right viewpoints at the table, and articulating to them that, you know, they have a piece of this that we don't have, and that's the skill and the strength that they're bringing to the table, so that we can understand that and incorporate that into the work that we're doing, and just articulating that value of what they do as the boots on the ground that are best able to help implement that and help us shape how it should be implemented. So I think it's more or less, and they saw the value of it, and they saw, you know, as we went through, you know, all of the tools that we have as an agency and shared those tools with Nicole, you know, how she took those tools and her graduate students took those tools and adapted and made the suggestions that, you know, our staff, our boots on the ground staff recommended. And that's always an important thing that I've always believed in, that people support what they help create. And so it was part of them seeing their suggestions and ideas being seriously taken and implemented that helped to further grow that support for what we're trying to do.
Thank you so much, Karen. That was very insightful. And so we are going to move next to Nkiru. Nkiru, and my question for you is, what are some of the key benefits of building a research and practitioner partnership that you have experienced in your project? How have you experienced those and maybe leveraged them as you worked with the DC Coalition Against Domestic Violence?
Yeah, thank you for that question. So there's four things that when I thought about this question, there's four things that came up for me. Number one is I think these types of partnerships really improve the science of what we're doing and the research design. Number two, I think it improves ourselves, like who we are as people. There's a lot of personal benefits to participating in these types of partnerships. Number three, I think it supports the ongoing change efforts that are currently happening in the community, and it bolsters them, it strengthens them. And then number four, I think it affirms what's important. So I'll talk about each of those and provide a few examples for each of them. So the first thing is about really I think that bringing researchers and practitioners together really improves the science. It really makes for better and more complete science. So in our collective, again, the Domestic Violence Action Research Collective, there was a wealth of knowledge. We had all kinds of people from multiple vantage points who were deeply invested in supporting survivors and creating a city a violence-free city. That was really important. So we had lawyers who were providing services to survivors who needed legal support, and so they had lots of different experiences that they were talking about, and it always came back to people also need housing. Like, it's very difficult to focus on getting particular types of legal support and not having a place to live, right? Being homeless is very difficult. We had the policy folks who were telling us a lot about the relationships that they had, the local policies, but also the federal policies and how that was influencing survivors' well-being in the city. We had researchers in the room like myself who knew the empirical evidence connecting homelessness to domestic violence, right, and all the negative impacts of being homeless as a survivor and all the causes to being homeless and domestic violence being a very strong predictor for that. We have practitioners in the room who were telling us a lot about their experiences serving survivors and also how difficult it was to support survivors in this rapidly gentrifying city. I'm sure like many other major cities across the country, gentrification made it very difficult for people to find affordable housing if they were trying to leave their abusive partners. And even despite of all of this knowledge, right, we still had so many more questions than we did answers about how it was we could create a study that would best get at, document, and provide sufficient evidence for the experiences that we knew survivors were having. And so we actually ended up inviting more people to the table, and specifically this a woman who was a housing expert in the field. Her name is Latoya, and we all came to this meeting and had this great discussion, and I think it really, a lot of our perspectives shifted, and the research design just improved because we had this information that really allowed for us to get at really precise, good questions, to develop really precise, good recruitment measures, to think about and figure out who else needed to be at the table in order to do the kind of work and make the kind of impact that we wanted to have. So there is absolutely no way, I can say this for a fact, that if it was just researchers at that table on our own, we would have been able to design the same kind of study. There's just no possible way. And to me, that idea that the lawyers in the room probably couldn't have designed the same kind of study. Just the practitioners in the room probably couldn't have designed the same kind of study. It was literally all of us coming together to figure out what is the best way to get at these phenomena that we all were seeing in our own work from our different vantage points. The second piece about that is doing collaborative work, again, really improves people, I think. It increases our knowledge, it increases our skills. A lot of people had a lot of strengths and resources that they brought to the group. And actually at the beginning of our formation, our very first meeting, we just listed all of the things that we have. We looked at our spheres of influence, we analyzed our spheres of influence. What do we have that we can use to ensure that our group can meet the aims that we've set out for ourselves? So me personally, I'm learning a lot about the nuances of systems change. I'm learning a lot about the history of DC. I'm learning a lot about the policies and the impact that they've had on communities, but also the unintended impacts that have happened on communities and what that means for the social problems that we see today in the city. I'm looking and have been thinking a lot about different ways to engage different types of stakeholders. And so I think it's both an intellectually stimulating activity for all members involved, and I think I'm learning, I'm just learning a lot of skills around how to advocate and how to engage with different types of people. And then the third piece is that I think what feels good for a lot of people in the group is that we are doing something that will necessitate actual change in the city. And again, we all have been working and living in DC for so many years, and we range from like 5 years to 25 years. And I think a lot of folks have been wanting and do engage in lots of activities that work toward change in the city. And I think that coming together as a group, organizing around a particular issue and a particular very specific part of a social problem, right? So violence is an issue, and we know homelessness is a major issue. It really allows for us all to feel like we're contributing to something much bigger than ourselves in ways that are maybe unique than what people are doing in their day-to-day lives. I think research can be energizing as well, and I think it's a tool for mobilizing change. And so I think we all just have this really deep investment in trying to figure out how to see the change and engage in the change that we want to see in the city. I think people work better when they're a part of a social group that has the same shared values and also a pool of resources. And it's affirming to the community. That's kind of the last piece of this. To say something is worthy of empirical study is to say that it's important. and that it matters. And I think that in particular, I wonder if on the community practitioner side, I've heard folks say, you know, it's just so good that we can study something that we know at a practice level has been happening, but to have the evidence to support it is going to be so helpful. And I don't mean to say, so there's empirical evidence and practice-based evidence. So to have the empirical evidence that we need to support what we know to be true is really affirming and is going to be helpful for us. So those are the benefits.
Thank you so much, Nkiro, especially for sharing those insights on a topic that is so under-researched, and as you said, so many questions that we have on the practice side about the intersection of domestic violence and housing. Thank you, Nkiro. So we have our final panelist, Carolyn. Carolyn, my question for you is, even though I know that your research partner is based at the same University of Iowa campus, could you walk us through some challenges, main challenges that you've experienced in creating this research practitioner partnership, and maybe share some solutions, or how were you able to address those challenges?
Great, thanks for the question. So in addition to the relationship and project that I have here at the University of Iowa, I've had an opportunity to do other researcher practitioner projects, one in particular where we worked with Iowa Legal Aid here in Iowa to conduct a longitudinal study of the effects of civil legal services on women who experience domestic violence. And we worked with Iowa Legal Aid for about 5 years to conduct that project, recruited 150 women into that study. So I've got a couple different perspectives of sort of the challenges here. And I think my experience is that one of the biggest challenges and one of the most important things that you have to do to establish this relationship is the time that it takes to really get to know each other, to understand how your practitioner organization operates, the services that they provide, how they work with clients, and some of that's necessary to sort of figure out the feasibility of your research design, but also to really immerse yourself and understand that agency. And for researchers who are academics and academic institutions, that time that it takes to establish that relationship oftentimes is not quantifiable. It's not something that you can put on your CV and have that count for something. But it's so essential to the success of the project. So the time it takes to really immerse yourself in the agency to understand the work that they're doing. When we were doing the Iowa Legal Aid project, we were fortunate to have a little bit of pilot money, but we spent about a year just doing pilot work with the agency, driving around to every Iowa Legal Aid office in the state and sitting in on case staffings and going to lunch with the staff, helping them understand the project that we wanted to do. This summer on our fellowship project, I spent a good chunk of the summer just sitting in an office at my practitioner organization, just reading through case files and then meeting with my practitioner and asking questions and really trying to sort of understand how they do the work that they do there and the importance of that time. I think the other challenge too is that sometimes people are nervous. Practitioners are nervous that the research that you're doing is somehow going to be critical of them, or that you're looking at their work product and are going to find some kind of inadequacies in the work that's being done. And so that trust of the relationship that you're building with the agency is really important to help them understand what the research is going to do and what the benefits of the research will be to the organization. And this sort of echoes what Karen was talking about, the importance of needing to bring everybody on board. So not just your contact person at the practitioner agency, but really making connections with everybody that you may have some contact with or you need some assistance with, or just helping them to really understand what the research study is and how it might be valuable. So when we were thinking about we were working on our Iowa Legal Aid project, you know, the way that I often thought about that relationship was kind of like a dating relationship initially, the time it takes to kind of get to know each other, to get comfortable with each other, then to decide and actually communicate about whether or not you want to commit to going to sort of the next level in the research project and what that commitment will look like. And I think another, maybe not necessarily a challenge, but I think a really important thing to think about as researchers in establishing these relationships is that it really needs to be a quid pro quo relationship. It can't just be the researcher coming in and wanting to get access to data and then taking that to go do what researchers do, but really being willing to do those extra things for the practitioner agency, even if they're not part of the grant-funded project or the research that you're doing. And so with our Iowa Legal Aid project, for example, after we finished that project, we helped create like one-page fact sheets that Iowa Legal Aid could use to present to legislators and funders. We presented at the Iowa Legal Aid Board. We presented at the Iowa Bar Association so that Iowa Legal Aid could get some PR for participating in this research project. So being willing to put that time in at the front end to really establish that relationship, but then also being willing to continue to put that time in afterwards, even if it's not something that was a specific product of the project that you were doing, but being willing to, if the agency comes back to you and says, hey, could we look at this as well, or can we break the data down this way, or can you help us explain this to a funder or another community partner, I think is just a really important part of this being a really mutually collaborative relationship that doesn't just start and end with that contained project that you're working on.
This is perfect, Carolyn. Thank you so much, and great on timing as well. So thank you all so much to all of you, the CVR fellows who joined this meeting today. And I want to extend special thanks to the panelists for sharing your knowledge and experience with all of us. I think this was a great discussion. Please, all of you, visit the Center for Victim Research website at www.victimresearch.org to find more information on building researcher practitioner partnerships, including our own searchable directory of victim researchers. This concludes our 30-minute session today, and we hope you all have a wonderful day.